Hi everyone, I just wanted to give a quick update before we start this session. So this is where the course kind of shifts gears. So up until now, obviously, we've been focusing on different developmental domains, talking about what those domains mean, what children's developmental milestones are. That's the 36, 48, 60 month kind of information. From now on, you will still occasionally see developmental milestone information, so that 36, 48, 60 months is going to pop up here and there. But we're kind of shifting to a different part of the course. So this is the part of the course where we're going to talk more about, now that we understand children's development, kind of what can we do with it. So if you are working with young children, perhaps in a classroom, how would you facilitate their development? How would you help them to grow and learn? What are the best practices to be using with young children? So today's lecture is kind of an introduction to this last third of the course. So we're going to be talking about developmentally appropriate practice, which was coined by the National Association for the Education of Young Children, or NAEYC. It is really kind of the premier professional organization in the field of early childhood. And some years ago, they came up with a developmentally appropriate practice book. So this is a theory of practice. This is a theory of things that work best with young children based on what we know about them developmentally. So I'm going to be talking with you today, or you're going to be reading about different parts of the developmentally appropriate practice rules, the things that are contained in this book written by NAEYC. What this is also going to do is this is going to be kind of our segue to our last remaining lecture topics. So one of the things that we're going to talk about today is how to assess children. That's part of the developmentally appropriate practice guidelines. And then later we're going to be having a lecture that goes into more detail about how young children should be assessed. Another example is we're going to talk about including families in programs with young children. We're also going to have a lecture that expands and gets more detail into how to work with families and what do families mean and all that kind of good stuff. So this particular lecture is kind of a spearhead for where we're headed next. It kind of lays the formula for topics that are upcoming, in addition to orienting you to the NAEYC Developmentally Appropriate Practice book, and kind of helping you to understand what that theory of practice is all about. Developmentally appropriate practice is a research-based approach to working with and educating young children. It has been around since the 80s. There have been multiple iterations of what is considered to be developmentally appropriate practice. So as you saw on the previous slide, we're on the 4th edition. The first 3 editions were all had green covers, and sometimes they were referred to as the Green Bible, or the, everything that you should do when you're thinking about interacting with young children. And they often referred to, as I noted on the previous slide, they referred to best practice. They referred to what you should absolutely be doing with young children, sort of that whole Bible reference. And now they don't advocate that anymore. They use research to think about what appropriate practices might be, but also recognize that there's a lot of variation in children and their experiences and the cultural context that they live in, and that it's important to take all of those things into consideration when determining what might be the most appropriate route to take with any given child. I think that's probably why they changed the cover to blue this time around, to get away from that whole Green Bible kind of reference. So as you can see on this slide, developmentally appropriate practice, again, it is a research-based approach to teaching and interacting with young children to think about how to help them to learn and to grow and to develop. So it involves both thinking about groups of children and also about individual children and the families and the context that they come from. So it's never sufficient to just think about the age of children that you're teaching. You always have to consider each individual child and the context that they live in. And you're going to see more about that on the next slide. The basic premise of developmentally appropriate practice is that our practice with young children should be developmentally appropriate, so it should be based on what children at particular ages are able to do. It should be individually appropriate. It should always be focused on what an individual child can do, regardless of their age, because we know that sometimes a 3-year-old can't necessarily do 3-year-old things, or sometimes a 3-year-old is able to do 5-year-old things. So in addition to paying attention to developmental skills, we also have to pay attention to individual skills. Finally, developmentally appropriate practice needs to be culturally appropriate. So we need to pay attention to what children are able to do in the context of their families, the societies that they live in. So 3 things. We need to be individually, developmentally, and culturally appropriate. In addition to the 3 core considerations that we talked about earlier on the slides, there are also 9 principles of child development that are addressed in the developmentally appropriate practice book. So these are things that we know from child development courses and research and knowledge that are important to pay attention to when thinking about the development of young children. So one is that whenever we think about children's growth, development, and learning, we always have to consider both environmental and biological influences. So it's that nature-nurture debate. We know that neither side is correct, that healthy development for children always depends on an interplay between the two. The second is that all domains of child development, all those different developmental domains that we've been talking about in the first 2/3 of this class, that they're all important. So we can't ignore physical development and only focus on cognitive development. We can't just pay attention to literacy and not think about language development. So every single piece is important and they all go together. They're all supported by each other. So how a child is able to do in one developmental area is going to influence how they're able to do in another developmental area. So we have to pay attention to the whole child and all of their developmental selves. The other is that play is key. Play is the way that we build competencies in all of those areas. And I think what's even more important is that play is not just important for preschool age children, it is important for children birth through age 8. So again, when we're thinking about early childhood, it's not just the preschool period, although I know we've focused pretty much exclusively on that so far in this class, but it is thinking about all the way up through 3rd grade and how play is important, and it is a primary vehicle for learning and developing in all of those different developmental domains. Even though the core considerations included commonality or thinking about age appropriateness, it's important to remember that age appropriateness is a guide. It's a sense of what children may be doing at particular ages, things that we expect children that they generally do at a particular age or a particular time, but it's important to remember that those individual differences often override that commonality, and that that's the most important, that there's tremendous variation in the way in which children develop due to their own individual biological characteristics and by virtue of the environments that they grow up in. The other thing that's really important to remember about this first bullet on this slide is the reason that that NAEYC took best practice out of the NAEYC guidelines is because there was this implication that if a child was doing something different than we generally expect to see at a particular age, that that must be a deficit or that there must be something wrong with that child. And what the DAP book is now trying to get at is the idea that individual differences are normal and healthy, and they can be adaptive, and they can be signs of resilience and strength and cultural beauty, and that there's nothing wrong with having individual variation, that's just the way that the world is, and that we need to consider that and factor that into our learning environments. Also, the other two bullets on this slide, that children are active learners. They are not passive recipients. This is not a behavioral approach, although behavioral approaches do have utility. The notion that children are passive, that they are not active learners and creating their own opportunities, is not correct. And that also, when we create environments where children feel like part of the group, their families feel like part of the group, that there's a sense of belonging, that all children learn better, grow better, develop better, are more motivated when they feel like they're part of a group, when they feel that sense of belonging. The principles included in this current iteration of the DAP book are these three. So one, that children learn in sort of an integrated way. So the idea here is that we need to create a foundation, and then we build off of that foundation. So, you know, that old adage that you don't teach a child to run before they can walk. They need to build the skills of standing, walking, and then running, and then doing things while they're running. Same thing when we talk about academic subjects. First we learn letters, then we learn sounds, then we learn how to put them together, then we're reading whole sentences, then we're reading whole books. So it's really important as educators to understand skills that come before, during an age period, and after, so that we know where we're building towards. That's where those milestones become important, so that we can think about, if a child is currently doing this, here's where they're going to be going next. If you understand sort of that building of milestones and skills and abilities across both academic subjects and developmental domains, you'll have a better chance of doing the second bullet on this slide, which is helping children to practice skills that they're currently exhibiting, but also providing opportunities and challenging children to start working on the next skills coming down the line. If you don't know that children run after they walk, you may not provide opportunities for them to run. If you don't know that children start reading books after they start reading sentences, you may fail to give them books to read. So always good to know how we can help children to achieve mastery in the place that they're at, and how we can challenge them to start building skills that are going to be next down the line. The final piece here is about technology. So I have many other lectures that I do on technology. I'm not saying just plunk children down in front of the TV or their screens. There is not really any data that shows that that's helpful or useful, except in very minimal amounts for young children. But it does not mean that technology cannot be a valuable tool. There are many things that we can look up and learn about. Children can use cameras. They can create PowerPoint presentations. Again, we're talking about early elementary school as well. So using technology and media in a way that furthers children's learning goals and helps them to be interactive and hands-on rather than passive viewers of screens. So passive viewing of screens, not something that we want to support or encourage, but interactive use of technology and media, yes, can be very helpful to children's development. In addition to the core considerations and principles of child development that are outlined in the DAP position statement, they also focus on elements of appropriate practice, and that's what we're going to be talking about on the next 6 slides. So the first one is focusing on creating a caring, equitable community of learners. So you can see on this slide, these are elements or pieces of this notion of creating this caring, equitable community of learners. So for example, they talk about everyone is valued, strengths-based perspective, recognizing that everyone has strengths and trying to figure out what those are, making sure that everyone is nurtured and has the ability to develop positive relationships with each other, respecting the community, making sure that everyone's physical health and safety and emotional health and safety is protected through the environment, that everyone feels psychologically safe. So these are relating to some of the topics that we're going to be covering when we discuss play and peers, diversity, and special needs. The next guideline or element is engaging in reciprocal partnerships with families and fostering community connections. So when we discuss families upcoming, we'll be digging into this more, but you can see that it is the notion of having respectful, reciprocal relationships with and among families, making sure families have ample opportunities to collaborate with facilities, to participate in their children's education and development, making sure that families have choice and that we're being sensitive to their preferences and needs, and involving families, making sure we recognize that they are their child's primary caregiver and that they are a valuable resource to tap into. The next guideline is related to observing, documenting, and assessing children's development and learning, which we will be covering in our upcoming lecture on assessment. But the idea here is to make sure that we are engaging in the practice of observation, documentation, and assessment. So even with young children, it doesn't have to be paper, pencil, sit them down, give them a test, but reflecting on how they're doing with materials and activities and opportunities and with their peers, and using some form of documentation so that you can make sure that you're planning appropriate curriculum and activities and assisting them with their development, also to make sure that you catch anything that's going on. So you should have some sort of system in place, whatever that is. If you're working for state-funded programs here in the state of California, you would be using the Desired Results Developmental Profile, or the DRDP. That's the system that is used in the early childhood world. Common Core would be used in the elementary school world. So you also want to make sure that whatever system or assessment tool you're using, that it's appropriate for the age of the children, their individual characteristics, the cultural background that they're bringing. Many assessments are only meant to be used on particular populations and for particular purposes. You also don't want to use assessment information to make decisions about what services children should have access to, unless you are a qualified school therapist or you are trained in assessment. We really should just be using them for the purposes of thinking about activities and curriculum, not barring children access. So just making sure that you're using these systems appropriately. The next guideline is teaching to enhance each child's development and learning. So this is really getting to know children, making sure that we are providing them with the best instructional approaches, that we are scaffolding them in the best way possible, that we are using a wide range of teaching strategies and approaches to make sure that we really are meeting the needs of each and every child. We should be thinking carefully about what children's individual goals are, what their family's goals are for them, and engaging in teaching practices that make it possible for that child to reach those goals and those milestones. The next one is planning and implementing an engaging curriculum to achieve meaningful goals. So this particular guideline and the previous guideline are going to be discussed more in our curriculum lecture, but the idea here is that we should really be knowledgeable about different curricular frameworks and approaches, and choosing the best curricular approaches and strategies for the group of children that we are working with, for each individual child, making sure that curriculum is appropriate for the age group, We don't want to be using an elementary school curriculum when we are working with young children. We don't want to use a preschool curriculum when we're working with infants and toddlers. So making sure that we are providing the best and most meaningful learning experiences. This particular element of appropriate practice is especially important to me because a lot of the work that I do in terms of professional development and research is related to teacher training and improving quality through elevating both teacher behaviors and the education and the training that they have. I'm currently involved in a project right now. It's a multi-agency county-wide endeavor. It's called Quality Start San Bernardino, and it is a quality rating and improvement system. So these are becoming more and more common around the country, and what they do is go and rate child care programs on different elements. One of them is teacher training, teacher education, and then they use those assessments, those evaluations of these different elements of quality to determine what kind of rating a center or family child care home should get. So in our county, centers and family child care homes can earn up to a 5. And we go in and we ask them about the assessments that they do on children, the training and education that their staff have. We go look at the classrooms. We look at how teachers are interacting with children. And then we use all those things to come up with a rating. And so centers are hoping to get a 5 because that's the best. But unfortunately in our area, a lot of them actually only score a 2 or a 3, which is pretty common. And the reason that these systems have become so popular, which why so many states and counties use them, is because we know that when teachers and centers do certain things, when they follow these elements of developmentally appropriate practice, that they have higher quality and that children have better outcomes. And one of those definitely is making sure that teachers have the education and training that they need, that we're reducing staff turnover, so helping staff to stay longer at centers. So I'm a little sad that we won't be talking about this particular element of practice in our upcoming lectures, but I do want you to know that it's a super important one. We want to make sure that preschool teachers, just like elementary school teachers, have training and education related to young children, child development, to make sure that they can do the best job that they can and provide the highest quality possible.